Good. So today we're talking to Nick in Kent. Nick, thank you for coming on. I know you've had a busy time with a family recently, and I think one of them's back to school now, is he? So you've got a bit more time.
Yes, he's back to school. That's right.
Yeah, that's great. Yeah. So thanks for coming on, Nick. I know that it's always hard to share personal experiences like this, but you feel this is appropriate because other people need to hear this. So we're talking about your vaccination history, basically, aren't we? And and
hmm
and, and how you're feeling from that. So timeline wise, you had an AstraZeneca injection in February, didn't you?
Yes, I was in group 4 because I have a low immunity, but felt fine, was doing fine, really well. Walked to my appointment at the local surgery to have my vaccination. And it was actually just by coincidence my own GP that performed the vaccination. And I sat down and he just ran through his how do you feel? And I said, really well. And he put the needle in, and I feel like I instantly said it. I mean, my circulation would have been going nice and brisk because of my walk, and I hadn't waited long. The appointments were running to time. So it felt instantly, I said, oh, I've got a strong chemical taste in my mouth. And he just made a sort of non-committal sound, and then I said to him, oh, I feel a bit sick. And he said, oh, you'd better go and sit outside, where they weren't keeping people outside. They'd stopped at that point, the sort of standard wait for 15 minutes. They were sending you home
Mm.
unless there was a problem. But so I sat outside, and I did the usual thing, got my mobile phone out and thought I'll start, replying to messages that I haven't got back to people. And I just felt overwhelmingly sick and rushed to the surgery toilet and vomited. And then a nurse took me back in to see the doctor. And I said to him, I can feel shivers running up and down my body. And it was just like a bam, bam, bam of symptoms that you could argue were unrelated, the shivering and the nausea. And then, believe it or not, I coughed for a bit. I mean, it was just like a checklist of some of the COVID symptoms,
Mm.
or even some of the COVID symptoms we now know.
Mm.
Um, and then my nose ran, just watery, running instantly. But the coughing and the nose running, which they now talk about all the time as being classic COVID symptoms, I'd be surprised if they even lasted a minute or so each. It was that fast, but it was so quick going through my body. And I can't honestly say at what point my head started to ache, but I had a headache when I was leaving. And they just said, oh, well, you better go home and take some paracetamol and rest. And because I think their main concern was my airway blocked. Um, I didn't feel any swelling of either my lips or my tongue, or my throat. So I couldn't say I felt like that, but I felt dreadful. And I had to get a friend to give me a lift home. And my son was visibly shocked when he saw me, because he'd seen me skip off to go and get it. I mean, and I really had, we're walkers, and
Mm.
I keep fit.
Mm. Mhm.
And I don't know, I don't really remember much about how I felt that the rest of that day, apart from I know I felt dreadful. But I do know that by 8 p.m., which is far too early for my son to go to bed, I said to him, come on, let's get you all sorted. And do you mind going to bed early so I can switch everything off and, lock up? And because I said, I don't think I can stay upright functioning for much longer. And by that point, I was shivering a lot. Um, I didn't have much of a temperature at all. It was just only ever so slightly raised. And I just remember going to bed at about 8 p.m. and just curling up in a ball and just shaking so violently, and my teeth chattering so wildly that and just like bam, 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 like that for a long, long, long time, almost convulsing, that I was, but it wasn't convulsions. I've seen someone have convulsions and it wasn't that, but it, that I just thought I'm going to crack my teeth with how violently they're banging together. For a long time, I lay like that in bed until I just fell asleep. So perhaps for an hour or so, I was shivering like that with my teeth, and I genuinely think I exhausted myself with it, and I just fell into a deep sleep. And I don't even remember waking up during the night, even though it was an early bedtime. But the next morning, when I got up, I don't know the exact order of what, there was a lot going on, which makes it really hard to relay. There was an awful lot going on. I had a strong pain in my kidneys, which from that point lasted about 3 or 4 days of drinking lots and lots of water, because I'm aware that that's something you can do for your kidneys. I felt incredibly dehydrated. Now, I know you will probably say if you have a fever, you want to drink plenty so you don't get dehydrated. But with low immunity, I've had many upper respiratory illnesses, just regular illnesses, lots of colds, maybe with a bit of a temperature as well and whatever. And I'm used to managing myself, and I'm used to always drinking lots of water and being well hydrated as an absolute, foundation of getting past any illness especially if you've got a slight fever. So what I'm saying is it was different. The level of dehydration was absolutely profound. And I looked in the mirror and I felt that even my face looked more wizened, and it's gone back to what I think is how my face normally looks. And my eyes were so dry, they were scratchy, I just was so dehydrated. So something about the process had really dehydrated me without me sweating, because I hadn't been sweating. And I don't believe I was sweating through that sleep because, my nightwear wasn't wet, or, like I've had the odd fever where your top's just drenched, isn't it? So it wasn't like that. It was just something, and I don't know, internally that had massively dehydrated me. And when I got up, I just felt that I was in like a hamster wheel, and I felt that the world was tumbling over around me. And I immediately fell on my bedroom floor and then got myself up again and felt I had to hold on to everything, and I just felt like I was really quite drunk, but not that I was just drunk, but also that when you're drunk, it's in you. But I also felt I was in an environment that was moving as well. So just like a ship, because we've been on a ship, and I know what that feels like when you're in a storm and the floor goes away from under you. Yes, so it was like that.
Pretty horrible. You see, that sounds like you're describing a vestibulitis, the middle ear, the inner ear problem that can make you feel dizzy.
Maybe, but I've had labyrinthitis,
right.
Which will make you fall off a chair and things, and it's very localized, isn't it? But this,
it felt like the whole world was.
Yeah. Well, no, I mean, I don't know, but it's localized to everything in my head felt confused, in terms of perception. In terms of where things were and my ability to do things. And for example, first couple of weeks, I didn't drive at all because I didn't have control of my feet. So I guessed it would be quite unsafe to drive. Nobody told me not to, but I didn't have proper function of, particularly my injection was in my left arm because I'm right-handed, and it was my right-hand side that was the weakest, in terms of losing motor function, which I can't explain that. And tell me, John, am I right? Are your kidneys on your right?
They're on both sides.
They're on both sides. Okay, the lower back. Well, I would say
so kind of upper back there, kind of in there.
Yeah. Well,
on both sides.
And I have had kidney pain in the past, with some hospital treatment that was intravenous. So, so I'm familiar of the kind of region. But in that case, then if they're on both sides, it would definitely be more the right hand side, because I specifically remember the pain, because it was so, if you have a few days of one localized pain, you just sort of remember it, don't you?
Oh yeah.
It was quite specific.
It's a deeply horrible experience.
It was.
And this went on for 2 weeks, or what happened after the 2 weeks, Nick?
Well, it has gone on until now. It is still going on, but it's done is, I would say, life has been so hard to just keep up with because of the physical battles, and also because of the time spent trying to research to help myself, as well as all the normal things in life. So I haven't looked back until today, funnily enough, at any of my notes that I wrote. I had this strong sense, even though I'm a person who's never kept a diary in their life, I was so terrified. I thought I kept a diary, and and look, a lot of it is I can't write, my hands, I can't control my hands and things like that. But I can't give you an exact time, but I would say, so it was February. Well, I had to have an operation at the end of April, and I didn't know that was a sort of deadline that I had to get myself. This was just personal, because I wasn't being told this by anyone, but I thought I have to get myself feeling normal enough to feel safe to have major surgery. It was, that was 10 weeks after the first injection. So I would say I was just about feeling that I was strong enough in myself. I still trip over my right foot, and I still have a lot of weakness in my right thumb in particular. But in the beginning, I couldn't move my right big toe. I couldn't make it move at all. Whereas now I can give it a little wiggle. And bear in mind, I had full function of everything. And
you were more than that. You were fairly athletically fit before this, weren't you?
Yeah. I don't know if I'd say athletically, but certainly I'm 50, and for my age, I'm a fit 50. I am, just because I try to keep, because of my low immunity, I try to keep myself as well in every other way as I can. And
So at the time, did the GP take your blood pressure and your heart rate and your temperature and your respiratory rate? They didn't do basic observations?
They didn't want to see me. They didn't want, no. I don't know. I wondered if I could read you something,
Please.
An email I wrote. I'll try and let me find it. So there's a website I want to give you. Yeah, this is it. Okay. Are you aware of this website, C19vaxreactions.com?
I've heard of it. I'm not over familiar with it. We'll put a link on it, of course.
There was, thank you. There's a US senator who I was watching him talk on YouTube, very moving speech. And he was talking on behalf of people in his community who had approached him, I imagine by a sort of MP type surgery, who'd approached him and said that they had had adverse events to whichever vaccine for COVID, and they'd been left in whatever state of ill health, and yet they were finding that no clinician, no medical settings were sort of welcoming them or wanting to help or interested at all. So I don't know exactly what happened to the wife of, I think it might be neurological, actually, because of the note I've written myself here after watching the YouTube video. I watched it in early September. But they started a private social media group and wrote to the White House and media drug companies. They got no response, felt ghosted, frustration with not being heard. And I know the husband started the website C19vaxreactions.com. And I think they've got, I don't know, they had a lot of people approach them just to tell their stories. And I was in such a desperate situation that I was doing anything at all to try and get someone to help me.
So your GP didn't send you to a consultant? So
no.
he didn't do the basic observations at the time. He didn't check your blood pressure, your heart rate, your respiratory rate, your neurological status. That wasn't done at the time. And then you weren't, when you complained about these symptoms, you weren't referred to a hospital specialist for an assessment?
No, the GP surgery eventually allowed me to be seen by somebody who doesn't ever work at their surgery, a young doctor who I've never seen again. And so it felt like I was just being passed on to the most junior person or transient person. So they just haven't wanted to know. And I'll give you an example. I was in the GP's this week, banging my head against the brick wall again. And I said that my immunologist had said I should have a booster, and I said, could I have that done here in the surgery? And the GP said, no, really, that's just for older people in the community, And I said, but so he said, you can go to a vaccination hub. And I said, but I said, and this was after a conversation that was really going badly wrong, in other words, I wasn't getting any help. And I said to him, but you can't have it both ways. You're telling me I'm clinically vulnerable and I've got to get a booster. And I'm so vulnerable, which I don't feel. Well, I feel it from my adverse reaction, but otherwise I didn't. But you won't let me come to my local surgery where it's better. Something goes wrong, you can monitor me.
Medical supervision,
rather than me drive myself somewhere where, because I there's I'd have to get somebody to drive me or something. But it's just upside down thinking. I don't understand it at all. I mean, everything they do, every single thing the GP surgery has done, when I've booked blood tests, I turn up. This has happened twice now since the vaccination. No record of the appointment. And so I stand there and put my foot. It's very hard to think it's not intentional. I can't quite believe it could be intentional. But today I went in again and I checked with the nurse and I said, you are checking for immunoglobulin subsets, aren't you? Because I said, we're trying to establish that I'm not clinically vulnerable. And I said, and if they're normal, I don't see how anyone can say I'm clinically vulnerable. And she said, oh, no, that's not on there. And that was left off last time on the 8th of November. So not long ago. It got forgotten last time. So we rebooked, my insistence to have them done this time. And they were doing albumin. What's that for?
Albumin's the protein in the blood.
Right.
It's what makes the blood, it's what carries medicine, it's what carries drugs in the blood. And it's also what sucks the water back in from the tissue fluids.
Right.
So it's the amount of protein.
They refuse. I've said time and again, after I spoke to you, I said, please, can I see a cardiologist? I have these racing feelings. I wear a fitness tracker, and I'm kind of used to, what that would be at. And the one thing I've noticed, unlike Kyle, who would be really onto his, whereas really I use mine for steps, just to try and make sure I achieve minimum steps to kind of keep healthy-ish. What I have noticed is if I go upstairs here, it would go really very high, which I think is very strange in a short space of time, given that I used to do 60 flights of stairs in the gym before, on the stair machine before the pandemic. And obviously I haven't done that. But what I have done a little bit strangely with the lockdowns and all the rest of it is I've had a
we're back.
Yeah.
Yeah, sorry, carry on. It was just a flick on the internet. Yeah, sorry, carry on.
No, I had a goal of 30 flights of stairs a day. So what I'm saying is, it's not as though you could say, oh well, perhaps you're just noticing because you're going upstairs, but it's one of the little fitness things we've done in the home gym, if you like, of the house, consistently. And so I have noticed swings in my pulse, you know, and
it goes up to a very high rate, Nick, does it?
Well, I wouldn't know a high rate from a low rate, unlike Kyle, you know, who knows
I see.
you know, fitness stuff. But for me, for me, it seems to go in one flight of stairs, which is about 12 stairs, it'll go up to 125. Right. Does that sound a lot? So,
it's much higher than you would expect for your level of fitness.
Yeah, whereas in the gym, when I used to do my 60 flights, which was a killer, you know, constant like this on the machine, I used to stop. That was, my heart was super fit, you know, but I used to stop at about 140 because I was advised in the gym that that's a good kind of place to, you don't want to over exert yourself.
So you've lost your exercise tolerance there. Your heart rate's going up disproportionately to the activity you're undertaking.
Exactly right. In fact, I would say, as a self-preservation sort of feeling inside me, I feel I have no ability to exercise at all. And because I used to run as well, and I don't feel that it would be safe. When I walk up a hill, I'm clutching at my chest, you know, the pain, and then I stop and I have to go. I just make this up, you know, but I'm a great believer in instinct in your body and things, and I just go, you know, and that's what I feel I have to do, and I just until the pain subsides.
So you get pain when you walk, when you start exercising, you get pain. Where do you get the pain, Nick?
There.
Right. So left side of your chest.
Yeah.
And what sort of pain is it? Is it like a gripping pain, or is it sharp pain, or?
That is sort of sharpish, but it's not like these little pinches that I get now, but it's sort of sharpish, but it's a frightening pain. It's a pain that makes you stop and think, that's not right. That's all I can say. I've never had a heart issue in my life, and it's a frightening pain. You just know it's wrong.
Yeah, I mean, this merits a cardiological assessment straight away, doesn't it?
John,
you should see a cardiologist straight away.
I've never been a hypochondriac. I've never imagined. Life is too busy, and I'm really, really lucky. I've cried a lot since all this happened because of the torment of medical people not wanting to help. You know, the absolute torment of it, and the frustration and the fear that there's something wrong with me and nothing's being done. And I've also felt, I feel quite ashamed, and I'll try not to be emotional.
It's fine, Nick.
Sorry.
No, it's okay. Sorry to put you through this.
Sorry. No, I'm just thinking about Kyle. I've also felt, and I feel guilty about this, but sorry.
Okay.
I've felt quite envious of all these people that you talk to who at least are getting the tests and the help, because I don't know, certainly my GP surgery, it's been an absolute turning their back. They do not want to know. I've had so many conversations with them now. I mean, when I say so many, since February, I'm talking maybe 8. Okay, I'm not obsessively phoning them every week. You can't get through. But when I've had those conversations, and I've probably only met face to face with them 4 times maximum, and bear in mind, the first time, this junior doctor, she said to me, that she thought it'd be a good idea if I bought crutches, you know, and I did go online then to buy crutch because I couldn't make it. She was right at the end. She's being junior. They'd put her right at the far end of this great long corridor, and it was a really long way to walk. And I was just tipping to the right all the time. So what I'm saying is they've seen me really bad. I can't remember what I was saying about it.
And the suggestion was to get crutches.
Yeah, the suggestion was to get crutches, but they won't look, and they won't. And I go in and I say, and I was very much, you know, you spurred me on. I don't mean that as in you're sort of influencing me, if you like, John. I don't mean that, but I mean you gave me just when no one else has wanted to know. It was such a positive thing that you were even interested, and. Sorry.
I mean, to me, these are red flag symptoms. You know, if you know, I worked after I retired from academia. I was a staff nurse for 3 years on a part-time on an accident and emergency department. And if a pain said to me, I've got left-sided chest pain that comes on when I exercise, and I've got pain now, I would go and get a consultant straight away.
Yes.
You know, there's no question. And then my consultant would almost certainly get the cardiologist straight away.
Yeah.
These are red flag symptoms. I just don't understand why they're not getting the attention they deserve. These need an immediate specialist diagnosis.
Yeah, well, the other thing is that something that came on latterly. You see, they say, oh, but you were fine with the Pfizer, so you can have a booster. But I don't actually. Who's qualified to say I was fine? Because what I know is a week later, the chest pains really kicked in more.
So you had the Pfizer. You had the Pfizer in June.
In June, yes.
Did you just clarify it, Nick? Do you have any chest pain before you had the Pfizer?
Yes, June? It had the chest pain instantly from the AstraZeneca.
Yeah, you were getting that before, but it seemed to get worse after that.
It peaks and troughs from February with the AstraZeneca never went away. But I certainly didn't exercise because I was working on just being able to walk. My son, because he was off school, we were walking. But it never went away. The GP has said, oh, you're fine. And so is the immunologist, without even seeing me, you know, said, oh, you're fine to have a booster. But I said, how can you say that? How can you know it's safe for me? And I said to the immunologist, because he's in London, I said, you haven't even seen me for 2 years, you know, because prior to the pandemic, they used to insist, which I was, a little bit baffled by. They used to insist they had to take all my bloods, my immunoglobulins, lymphocyte subsets, everything at King's every 6 weeks. And I was trekking up and down there every 3 weeks for 6 or 7 years. OK, pandemic came. Suddenly, no, it's not important. We don't need to see, which has been many people's experience, more or less, hasn't it? If you've got something, a sort of ongoing something that they think needs to be monitored, and then all the hospitals closed down. But I've actually been fine, and I haven't had any intervention, you know, medically or anything, and I've been okay. And I believe I've had COVID at least once right at the beginning, or maybe twice. And I also had the toes, John, because I phoned up my GP in March 2020 and said, I don't know why, but my toes gone. Yeah. So, you know, I really think, and I'd had it prior to that. So I think that's why I only had the toes and a headache, but we didn't know about that then. It was just an odd thing. But anyway, sorry, going back to
this is 11 months before your first vaccine, isn't it? You feel you had the infection 11 months before.
Yeah, and then 11 months before, and also even before they even really say it was in this country, because I was hospitalized with not being able to breathe, you know, with low oxygen, and it was a really strange illness, and a lot of people around were strangely unwell, which looking back it looks, and then I had the long.
I mean, March from my memory is quite a feasible time to have had it.
Oh no! Prior to March, it was
March.
It was September, but I looked on a proper legit website, and there was a SARS. There was an unknown SARS COVID thing in Ashford in Kent, which is at the time, you know, where we were sort of having a lot to do with.
I mean, the full history of this is not written, Nick. That's for sure.
There's
a lot we don't know, certainly. Yeah. Have you ever had blood tests to determine whether you actually did have COVID? Have you ever had the antibody tests?
No, but when the first GP gave me my AstraZeneca vaccination, he said to me, "Don't know why I'm doing this because you probably won't make any antibodies anyway," meaning because of my low immunity, because I generally have a suboptimal response to vaccines. However, the thinking was that you might as well, it's safe and you might as well go for it anyway because you might make a few. So I was perfectly happy on that basis. I paid for an antibody test in it's the end of March. So it was halfway through February when I had my vaccination. So it was a good time period for me to have made antibodies. And I had made some antibodies to the AstraZeneca.
To the vaccine,
I'm presuming it was to the vaccine.
Yeah, it would be. That test would be antibodies to the vaccine.
Well, no, they said that it was in a clinic, and they did say, I can tell you the clinic. I know it probably means something to you, but it was a proper one where they drew blood. But they did say the specific test I had, although it cost a lot of money, it couldn't actually tell you whether the antibodies were from here you are. It was this method. Even I had heard. So Roche ECLIA.
Right. So but they said it wouldn't differentiate between antibodies from the virus and antibodies from the vaccine.
Most likely, though, given that I think I had COVID late 2019 and then March, April 2020. I don't think my antibody, because do they still say that you don't keep your COVID antibodies for long?
Yeah, the antibody test may not have shown after about 6 months or so. But the point is that these reactions could be caused by all your memory cells, which
the B and T cells.
The B and T memory cells.
Which I choose to believe mine are good of those, because nobody's ever told me they're not. I might not make excellent antibodies, although I did make a few to this, but in general I may not make have the biggest antibody response. But there's nobody who's ever said, no immunologist has said to me your B and T cells aren't functioning correctly. So I think you're right. I think I have got natural protection.
Yeah. Going back to when you first had this first AstraZeneca and you got this taste in your mouth, Nick.
Yeah.
Do we know if the GP aspirated the needle or not?
He absolutely didn't, and I think the problem with GPs doing it is that generally they don't dole out the injections.
No, but very often they don't. I think there was a financial incentive at the time.
Yes, and he just literally put it in, done. Very quickly. Wouldn't even, I don't think, given that I've got a fairly sort of narrow, I want to say flabby, but that's a little bit unkind, but I don't have a firm deltoid muscle there because I hadn't been doing my usual swimming because of however long a year of lockdown. So the leisure centre had been closed down where I used to swim all the time. So my muscle tone had gone in my upper body, and the stairs wouldn't help that, would they? So
no, not really.
No. And I hadn't done anything with weights or anything. So I'm just saying, I think he would have struggled to find a, he may easily have missed the
muscle bulk.
Yes.
You see, if you get a reaction straight away like that, to me, it can only be one of two things. It can be that it's gone into a vein and it's gone to your heart in seconds, or it can be an allergic reaction that can be that quickly.
Yeah.
So they were worried about your airway. That's probably why they were worried about your airway, but that was okay. You didn't swell up. Your breathing was fine.
Yes.
Did you get any itching at the time? Do you remember?
No. Right. I'm not an allergic type person.
Yeah. See, with allergies, you'd normally get itching.
Yeah, every day I had the mildest allergic type reaction, which was every afternoon for about the first couple of weeks, my lips would start to sort of just swell a little bit and feel a bit tingly, and then that would go down. And that was I just saw that in my diary today, but
this was in the days after, it wasn't at the time.
Yeah, no, in the days after, for about a couple of weeks, but I certainly didn't have a big allergic reaction. And I would say, John, I can only speak for my local surgery, or actually also the hub where I went for my Pfizer. It seemed very much that all they're looking for in terms of adverse events are those type of allergic reactions. And so my immunologist drove me to distraction the last time I had a telephone appointment with him, when he said I could have the booster. And I said, and he said, nothing you say gives me any because I talked to him about exemptions, you know, and he said, nothing you say gives me any reason to say that you should have an exemption because you're not allergic. So
this was a consultant, and he was only thinking in terms of allergies, nothing else.
Yeah.
So it's just so disappointing, isn't it? Just so hard to explain. I mean, I think we conclude that metal taste was because it inadvertently went into a blood vessel, and that that is a big variable in what's caused these problems, Nick.
Yeah.
I really wish people would start listening to this, and you know, I have the same frustration. I mean, I've written to my MP. He wrote to Nadeem Zahawi. I got a letter back from Nadeem Zahawi, the vaccine minister, saying, "Don't worry about it, John," or words to that effect. You know, but
I love. It's like John. It's like a moment of comedy gold. Your video when you throw it over your shoulder, the letter. It's really funny. It's really funny.
That's all the use it was, Nick. I'm afraid.
I mean, it. And
tell us how you're feeling. Tell us how you're feeling now.
I feel unsafe. I feel hounded by got to have a booster, got to have another, and I don't feel that it's. I think because the other thing that we haven't mentioned, because I think it's unfortunate I've had so many symptoms, but I think there were two things going on, because I also had prior to any talk of blood clots or anything like that, a sort of searing pain down the side of my nose and above my eye.
This was after the AstraZeneca, Nick, was it?
After the AstraZeneca. And I've never had any kind of headache like that. And it's written down, thankfully, the locum at King's, my immunologist who I've seen for 10 years, who is an honorary, you know, high up lecturer in immunology, bags of experience. The minute he heard that it was an adverse reaction to the vaccine, he and the team passed me on to this student who then rang me up, very, very nice young woman, but no experience whatsoever in immunology, you know. But what she did for me, which I think is an important thing, is she at least wrote down all my symptoms that I was relaying over the phone. And when you read them now, it's quite chilling, because it's I'll see if I can just see it here. But she says that and bear in mind, okay, I'm not imagining this because I'd heard about these what are they called, cerebral venous the nasal
cerebral sinus venous thrombosis.
Yes, sinus, that's it. I have never had I don't really get sinusitis, certainly not like that, you know, maybe the sort of dull headache up there with a really stuffed up cold type thing, but I've never had a pain like this in the side of my nose and above my eye. And so she wrote this list of symptoms from King's Immunology, but this locum immunology registrar. Yeah, I don't know.
Well, registrars are quite senior. They should be, you know, registrars are not junior doctors.
She told me she was new, so and she didn't. But well, even so, I've been there 10 years. I've never, you know, I sort of know the main ones.
Sure,
but anyway, she well, I'll read what she said. She says, so and this was with me pushing and pushing and pushing, and this is dated 26th of February, so just under 2 weeks after my vaccination. And to my GP surgery, I'm writing to kindly ask you to evaluate this patient who reported multiple symptoms which started immediately after having the COVID AstraZeneca. They are profound and getting worse. The symptoms are struggling to control her arms, hands, legs, distinct taste in her mouth, which comes and goes. Now that was different. That wasn't the chemical taste still after the 2 weeks. That was a kind of sweet taste that I had developed, which sometimes I still get. It comes back again, you know, less and less. Have you heard anyone saying?
No, I haven't. Not an ongoing sweet taste. No, I haven't.
No, not an unpleasant taste, you know,
but not normal either.
No, I've never had that. But if you think COVID does affect people's taste and smell, doesn't it? So maybe something in the mix that, again, because it seemed to bring out these symptoms of COVID. Anyway, difficulty to, that was, good. You see, I haven't read this because, as I say, I don't dwell. I'd forgotten this. Difficulty to swallow. That was so frightening, not because it was swollen, but just because I'd lost a lot of control of my muscles. And she's put, although the patient is able to drink fluids, eat food without choking, coughing. Well, you only have to choke and cough once, don't you? Absolutely. Especially when you're on your own with no husband, you know, and just a child in the house.
Absolutely.
And I think that's a silly thing to say, because she said to me, well, have you choked or coughed? And I said, no, but I'm very frightened.
You would,
because I said, I go to swallow and the Adam's apple sort of thing won't, you know, it moves down, doesn't it? But it won't do that. And
it sounds like a loss of neurological control, Nick, doesn't it?
But lots of sharp pain in the left side anterior chest. Don't know what anterior means.
Anterior means front as opposed to posterior.
Okay.
Which means
That's dry, sore eyes, decreased control of whole body, more pronounced on the right side, impaired balance. The patient reported that she was about to fall down the stairs. I actually did fall down a couple of stairs, but there was one time where I just completely sort of lost my bearings at the top. And I've lived here 10 years. I'm very familiar.
Where you are.
Yeah, I wasn't moving fast either, but I just saved myself from falling down the whole flight of stairs. Headache, complaint of clumsiness, kept bumping into furniture. I've forgotten all this, John, you see. So my motor skills have improved with work, just with keep trying. Feel like I'm being pushed over all the time. Urine is darker. Knows she needs to drink plenty of fluids. Reported loss of power in hands. Could not write a letter. I tried to write a letter to my aunt because she doesn't do anything technical, you know. And she'd sent me a get well card. So I tried to write her a little note back, and I found that I couldn't hold the pen properly. Hand felt exhausted up to her shoulder with messy handwriting. Feels fatigued and exhausted. Does not think she's able to have a stable walk, not able to walk normally. And bear in mind, I was saying to immunology, who've had me in their care when I've not been as ill as at this point, wanted to see me all the time. They didn't want to see me. It just seems balmy. But pins and needles in the legs and arms and cramping pains in the legs. And that was strange because when you're swimming a lot, which I've always loved swimming, sometimes you get cramp in your calves. But this was a new cramp to me of cramping in my thighs. I've never had that in my life, and jumping of my muscles in my thighs, particularly on the right hand side. That was a horrible cramp, and it kept happening, and bouncing, jumping muscles in my body for no reason, you know, but particularly.
Did your muscles feel like they were kind of flickering on and off sometimes?
Yes, they will. When I would lie down at night, I was listening to someone else, actually. Do you know Dr. Mobeen?
Yes.
Yeah. I watched a number of his videos. Sorry, John.
No, it's fine.
But he interviewed someone actually who had the tinnitus, which I would say to you I didn't have. However, what I had was just this, again, it's like a bit it's probably not very helpful to a clinician like yourself to say this, but when I would lie down in a quiet room at night, my whole body felt like it was going, you know, just the whole length of my body, my arms, my everything buzzing, everything. And I'm not, in the first few weeks after the vaccination, I obviously didn't even think about having a drink. alcoholic drink,
Alcoholic
just
drink,
because because I felt so unwell. So I just wasn't in that frame of mind. You know, I was surviving, literally on survival mode. But when I first, I like a glass of wine at the weekend.
Yeah, we all do. Yeah.
And but I really am not a big drinker, but I do like a glass of wine at the weekend. And when I had, when I opened a bottle of wine for the first time, and then the same the weekend after, so I sort of see a pattern. I thought, aha, this is right. I noticed that on the nights where I'd had a couple of glasses of red wine, so Friday and Saturday, let's say, and then my bottle's finished until next weekend, I'm quite disciplined.
Very restrained,
yeah, very restrained. So but I noticed that this great jangling of all of your, you know, the nerves are so noisy, everything's buzzing, like my whole body's buzzing, and it's a horrible feeling. But I noticed it was kind of dampened down a bit. And I remembered I knew somebody who had an essential tremor, and she said to me that, I remember that from years ago, she told me this, and she said, of course, it's not a good thing to drink red wine, but if I do have a glass of red wine, I find that my tremor isn't nearly as bad.
And then you found that it seemed to dampen down the symptoms a bit.
Definitely, but yeah, so I didn't have tinnitus, but
it just all sounds so neurological, Nick, you know, because obviously alcohol is going to inhibit the functioning of the nerves, and it's all consistent. You know, this just demands a neurological opinion from a senior neurologist. It's just such an obvious referral.
Immunology, I felt, first of all, that given that I was under the care of an excellent immunology team, I felt they should be looking at, and I've, you know, put it in writing to them at the time, that they should be looking at what it is in my particular immune system that has allowed the safe vaccine to affect me so catastrophically, you know, and it was utterly terrifying. But they immediately said, no, you tell, and they wouldn't even, in the past, for things that I have felt are so trivial, they've passed me on to different departments at King's, let's say rheumatology or whoever.
Which is what you'd expect.
Yeah, they wouldn't even do that. They wanted to delay things. This is my interpretation. Okay, of course, they didn't say to me, we want to delay your care. But what they wanted to do was write to my GP surgery and then wait for the GP surgery, who told me they had a 3-week admin turnaround of receiving letters, and then they scan them through their system, you know, and it's just so to say to the GP that they should make a neurology referral. And when I spoke to this sort of transient GP there that I got to see about that, she said to me, well, you're looking at a sort of 6 to 8 month wait before you see a neurologist, because she said, and you won't, why would you go any faster? And when I battered down doors to speak to a GP recently to get these blood tests, and to say, could I please see a cardiologist, having spoken to you, John, she said to me, we'll get a chest x-ray. I didn't really feel that would necessarily help my heart.
I wouldn't have thought so.
No. And she's quite an experienced GP. I feel it's very difficult not to feel they're prevaricating. They're doing everything but. And I said, a cardiologist, my heart hurts, you know. And then under great pressure from, no doubt, a really irritating patient sitting opposite you, you know, a patient who's demanded for once not to just talk over the phone, but to actually seen. They were already irritated that I'd said I had to be seen in the surgery. She then organised this, and you'll correct me on it, I never know which it is. Is it EEG or ECG when they put the little...
ECG, electroencardiogram, or they call it AKG in the States. ECG.
Oh, do they? ECG.
Yeah. ECG, yeah.
Which 2 weeks later, that appointment, then I turn up for it. Oh, no record of that. No record of your appointment. And I absolutely, and this has happened so many times. And so I said, well, I'm not leaving. I said, I told a white lie, and I said, I can't come on any other day, and it has to be done. And so then the nurse came along and she said, well, I'll do it quickly. And I said, well, I don't want it done quickly. I want it done how it should be done. I said, I don't know how it should be done, but I want it how it should be done. Anyway, she sat me down because I'd waited, because I didn't have an appointment. So because I'd waited a long time, I was in total resting mode. You know, I'd been sitting there, made me wait about 40 minutes because there was no appointment for me, you know, so they were doing me a favor and fitting me in, even though I had an appointment. And she then spent quite a while, as anyone would, sticking all these stickers, you know, on your wrists and I think on your ankles or something, and you know, several on the front of my chest.
6, yep.
And that took a little while, as you'd expect. And then she said, done. And I said, what, have you done it? She seemed to have literally switched the machine on, and she said, it's just a snapshot. And she said, yes, in 10 minutes time you could have an event, or 10 minutes previously you could have an event. But she said, this will tell us whether you've had a severe heart attack or not. And she said, I've got a 30-second snapshot.
Well, that probably is about right. It does take about 20-30 seconds to record it. Yeah.
Right. So but she said you're normal. So would
well, who said who's she?
The nurse. She said it looks normal.
Well, you would normally get a senior doctor to interpret an ECG.
Yeah, but is it possible, John, that you could still have myocarditis or pericarditis and that ECG would look normal, or is that
it depends how experienced the eye is that's looking at it,
right?
I mean, to diagnose those conditions you want probably more sophisticated tests. Yes but I mean, just to say that an ECG is normal, it's not. You know, there's still, it's only one of several cardiological investigations. It's the first one that you always do, but you always get, I mean, I used to record, you know, on A&E, we would record a dozen ECGs a day, no problem at all. And I would always look at it, of course, but you'd always get a senior doctor to sign it off. It's not, you know, it's not a casual thing. It's not like taking someone's blood pressure and just writing it down. It needs an experienced reader to diagnose from it, and even then, sometimes if the doctors there weren't sure, they get a cardiologist to look at it.
Well, she said that looks normal. Those were her words. She said that looks normal, and then my feeling is that looks normal is the end of it. So I said back, because obviously I'm getting belligerent now. I said to her, but it's not normal what I'm feeling and what I'm experiencing. So even if that, I'm not disputing, that may look normal, but
you felt dismissed.
Well, yes, absolutely. And I don't know why that. I feel that it's going to be left so long that the next thing I'll be told when I eventually see someone is, oh, you've developed this recently, you know. But the only thing I've got in my defense there is that I've consistently
documented.
I mean, you know, it's really not. It's very difficult to feel that it's very difficult. It would be easy to just put your head down and walk away and go, okay, then I'm imagining it, you know.
Well, I think you and me both know that you are not imagining these things. These are genuine clinical features that you're describing.
Yeah. And also, John, the sharp pain when I breathe in, which is in the upper left as well. I've never had that before in my life. I don't know why it hurts to breathe in. And when it was at its peak a couple of weeks ago, everything slightly fluctuates. You know, it doesn't all stay, but the heart pain never goes away. Sometimes it's more severe other times, but since February it's never gone away. I've never been without it. But the breathing in, so therefore I was breathing in a really shallow way because it was hurting to breathe in, you know. And
I mean, again, this is a classic clinical feature that everyone learns. You know, if you get a pain when you breathe in, you know, it's usually the membranes round about your lungs, a pleurisy, or the layer round about your heart, a pericarditis, and you would investigate to find out which one it was.
Yeah, and that the pain when I would breathe in wasn't here or here, it was here. you know, so it was just in that one region. Yeah.
Yeah. So, I mean, it's just so frustrating that you just basically undiagnosed. We've got all these clinical features, but we haven't had a consultant to say what they put them all together and say what they mean and order the extra test to make a diagnosis.
No, I think there's a real, I don't know what it is. I think that the GP surgery and the consultants that I have encountered are somehow not wanting to look at vaccine issues.
Yeah, it sounds
a
bit inconvenient to look at vaccine issues, I think.
Yeah.
Yeah.
Do you you were saying something about the British Heart Foundation that
I believe they've got they're getting a help group now. We'll check on that and put the link on that. But I believe there's like a self-help group that's formed under the auspices of the British Heart Foundation, which of course is charitable.
Right.
Thing. So that would be good. I mean,
for a self-help group for what? For anything in particular?
I think it's for people with cardiovascular complications after vaccine or after heart,
really?
after COVID. I believe so.
Yeah.
I think they cover both. And of course, we're getting all these clinics around the country now to look at people with long COVID, these ongoing features. And you've just so clearly got ongoing features.
Yeah.
I wonder if that's worth a referral to that, a referral to the long COVID facility. That might be an angle to try.
Maybe, but the problem I have is no one will refer me to anything. I mean, that really is the problem, because we paid 100 and I think something like 135 pounds to go to a neurologist. I had to pay because they said, oh, you'll just wait for so long. So we paid to go to a private neurologist, and I was only allowed to do that because we don't have private healthcare, because I was in that channel of you're permitted to get a referral to neurology because that has kind of already happened and we were going to do it on the NHS anyway.
I see.
So, for example, of course, John, it's not right. It's really, really wrong. You know, I've worked and paid into the NHS and everything. I shouldn't have to be paying individually a small fortune each time for private healthcare when I don't have it.
So completely.
However, I would pay to see a cardiologist, but well, I'd kind of I say I would actually, but the neurologist I went to see wasn't open at all. What he said to me was, I don't think you've got a neurological disease.
I mean, given that the clinical features you've described to me, I just find that incomprehensible.
But I still couldn't understand why he was talking about this, because I wasn't turning up saying I'm finding when I wake up, this happens, no connection to a vaccination. I was having neurological symptoms, which I believe there was some event that also happened at the time because of this feeling. Well, I said, that's what I was going to say. This is what the King's registrar wrote down. Feels that her nose, and she's put quotes, will burst. Feels like she will have a nosebleed. Sharp pain over the right hand side of the nose and above the right eye. And that was so specific, and it was ever present for, I don't know, it didn't start in the immediate aftermath. I'd say within the first week at some point that started.
After the AstraZeneca or after the Pfizer?
After the AstraZeneca.
The very first one.
It was so searing, the pain, and so like there, and and that, a strange thing to say, but feeling that it will burst. I just felt there was going to be an explosion of blood in my head, and that was before we knew about that I didn't do my research. That sinus venous. And objective. I learned a tiny bit. I like to try and learn the jargon, but it doesn't seem to sink in. Another thing I had was problems with speech and thinking, like initially I'd say totally the wrong words for things.
Right.
I'd forgotten that, but it's in my diary, that speaking to my son and just saying, well, I think one of them I wrote down, I said box when I meant shoe or something, and you think, okay, shoe box, so maybe there's that connection, but I don't normally say silly things, there were lots of things that I was saying incorrectly. But what was I going to say? The blood tests that I insisted on happening it would have been within 2 weeks of the AstraZeneca vaccination, because I felt at minimum they should be looking at my blood, and I really had to fight for this. And they only did absolute cursory basics of, your full blood count or whatever. Yeah. However, my platelets were 427 or something. And I've got 10 years of platelets from King's, and I've also had subsequent platelets, which and my normal would be around 350 or whatever. So that ties in, I think I'm right in saying, with the dehydration and, something obviously had happened.
It sounds like a concentration effect, that you had slightly more platelets than normal.
Yeah. It's never rocketed up that high. It's not typical to me at all. It might be typical to other people, but it's not to me. But I think, well, I don't really know where it leaves me, to be honest with you. I don't know what you think.
I mean, I don't think we have answers. This is the problem. We want answers, yes, and we haven't got them. But I think what you've achieved today is there'll be a lot of other people can relate to what you're saying. And, we just need to get people to start taking this seriously as a medical problem, to get it diagnosed and to work out what the best treatment strategies are. And I think that's going to be the next challenge. But the immediate challenge is we just need to get people believing, when the patient says, I can feel my heart, then we have to believe them that this is true and investigate accordingly.
Yes.
You have to believe what your patients tell you.
Presumably for me, it's not too late for that to happen. They
you need a neurological and a cardiologist full assessment yesterday, as far as I can see.
Yes, I mean, if I had to choose, I really would choose the neurological side of things. I feel are just computer glitches now, where sometimes when I'm tired, I start to stumble over my words again. And I know that my thumb on my right hand side, it's not. I used to think the space bar was broken when I first started using the computer again, but what it was, my thumb wasn't pressing it down.
I mean, these aren't clinical features your brain's going to make up, are they? These are genuine features that need to be properly assessed and diagnosed.
And also, I know for a fact, because I know someone, sadly, who had multiple sclerosis. She's not with us anymore, but she. So I know your voice can go, and the thing that really upset me was, well, one of many things, but kind of personal, was that I've lost a chunk in my singing range, where I have there's no oomph, there's no nothing there in the muscles of the voice box, so it's improved on what it was in February. And again, as with the drinking alcohol, it wasn't something I even thought of doing for a number of weeks, if not a month or so. I didn't think of singing. My life was turned upside down,
Sure.
But when I did sing to something, I thought, oh my goodness, I can't sing anymore, and I've done that my whole life just for pleasure.
It's an important thing for you.
Yeah, so that's neurological as well, I believe.
It sounds like absolutely.
And also, John, my dentist said that the AstraZeneca moved everything so much, and I've got all this pain in my neck and everything. A lot has shifted, that I'd gone, nearly 50 years, or have, when your teeth come out. Anyway, so now I've got an extra tooth has come through because everything's shifted. That's objective. That's not
like muscle spasms or something.
I honestly don't know, but there's so much pain in my neck since it. But if you Google it,
it's made space for a wisdom tooth.
Yeah, but if you YouTube it, there's surprising number of people with incredible neck stiffness and on the side of the vaccination. So, but for me, a tooth came through, and also I never wore glasses before.
Yeah.
And my eyesight went. This neurologist that I saw said to me, you say you can't see very well. And I said, I dramatically can't see very clearly at all. Everything's blurred, far away and whatever. Anyway, I eventually went to an optometrist, and she said that not only do I have I have a prescription for distance and close, where, bearing in mind I didn't need any glasses before, but also now I had to go back again. And she said, what's happening with you? And she said, these were her words. She said, the AstraZeneca has weakened your eye muscles so much that the range that an optometrist would work within, where they like the person's eyes to do a little bit of work to keep up, they don't want to make the glasses do everything. She said, but your ability for your muscles are so poor now that you're outside that range, so we need to give you extra help. And so those things are objective, a tooth coming out and not out, coming down, and also my eyes. I think it was quite a profound assault on my body, my whole body. There's almost nowhere that, you name any part, and I can
affected everywhere.
Yeah. Not particularly my stomach. I would have to say, actually, cast iron stomach.
Good. Yeah. Nick, thanks so much for that, and I'm sure a lot of people are going to relate to this, and we'd love to hear from you again, whenever you feel like it, a few weeks or a month or two down the line, and tell us how you are. And I suspect we're going to get a lot of people commenting. And,
I feel embarrassed about crying.
It's up to you. We can cut that out if you like. You can decide.
Well, no, but I actually think it's important. I think it's important because I'm strong, and like mentally, I'm lucky that I'm quite strong. But I'm aware of people online who you can just see they've been adversely affected, and actually they don't even. If anyone throws me a rope, I'm still wanting to take it. I still hope that I'll be helped and I'll be improved. But you can see some people, I see the odd comment, where I do share in the comments that something bad's happened to me, and someone else says, yeah, that happened to me. But you can just tell that they're really in a dark place. Whereas I'm not in a dark place every day, and I try to think positive, but it's really hard. It's really hard when you feel that the medical sort of, the NHS or whatever around you that you felt was there if something went wrong has abandoned you.
Well, I'm hoping this is going to help to change that.
I hope so, John. I hope so. And can I tell you one last thing to end on a light note? Going back to aspiration, did you happen to see yesterday on YouTube there were various videos covering the vaccinating going on in Vienna in the brothel?
I didn't. No.
So it was fascinating because I did what you did with the footage from China.
Yes.
Because I remember thinking when I watched you with the footage from China, and you said, I'm going to slow that down.
Yeah.
Because I've no experience this, and you obviously know all about it. But you can. So I was rewinding and I was looking again, and believe it or not, in the brothel in Vienna yesterday, which was covered by a few YouTubers, if you look closely, they put the needle in and then they quickly just slightly draw it back. And then they even aspirate in Vienna in the brothel.
I'm going to look at that, Nick. Thank you for that.
You must. You just do Vienna and brothel. And the other thing is, John, tell me if you know this. It will be really, really interesting to see the data from Denmark.
Yeah, there's a professor in Denmark who's collected this data, and I have emailed him. And I'm just waiting for him to get back. Yeah, they are. Yeah, I'm waiting to get that back. I'm hoping to get that back soon.
Yeah.
And also there's Jim, who's a journalist in Taiwan, who's checking this out because it looks like they're aspirating it in Taiwan as well. So I'm hoping to have data from Denmark and Taiwan.
Yes.
And I'm pretty convinced it's going to show less vaccine side effects. Even if it doesn't, it's just a variable to get rid of. I'm not saying this is caused by intravenous vaccination. We don't know that.
No.
This is the whole point. It's a variable we need to account for. It's a variable we can get rid of so easily. And I just find it so frustrating that it's not being done. But I also find it one heck of a coincidence that you and Kyle both had that metallic taste within seconds of the injection.
I call it chemical, but you know, I mean, it's
No,
just a word, isn't it?
It's something in your mouth.
It's an artificial taste that's not like food or anything.
Because you get that. I've noticed that since I was about 19, giving intravenous injections or watching intravenous injections when I was 19. You know, that some drugs the patient can say, "Oh, I can taste that," but it's because it's going around. Quick. It's because it's circulating to the tongue within about 10 seconds.
Yeah. And so, but no, it will be, I agree with you. I think that the figures will be lower if they really have been doing that in Denmark, because they've rolled it out to almost everyone, including children, haven't they, in Denmark?
Well, I'm pretty sure they have. It was a directive from the, I don't know the names of the authorities, but the Danish medical authorities and the Danish nursing authorities both sent this round as a strong advisory, and I very much suspect that they have actually done that. So,
John, do you think there's any hope we'll get it changed here?
If there's data from Denmark and Taiwan, yes. I don't think the authorities here don't want to admit they've been wrong all this time, so they might sort of tag it on as a recommendation.
Right.
And I think that's the best we can hope for. But as of now, there is no sign of it at all.
No. And the lead nurse who was dealing with secondary school vaccinations, 12 to 15-year-olds, in relation to my son's school, I was lucky enough to, with persistence, get to speak to her on the phone. She was a lovely woman, and she's been 15 years vaccinating and in charge of these type of programs. She said to me she'd never aspirated on anyone ever in her life, so she was surprised. But she wasn't hostile. She was very pleasant. But you know, I just think it's so important from a safety point of view. That's correct.
It's correct following the World Health Organization guidelines. But I started doing when I was young. I started doing thick, oily intramuscular injections.
Yes.
And with those, it's absolutely vital you aspirate. Now, the World Health Organization did say that for pediatric vaccinations, you don't have to aspirate. I think they were wrong, but that's the guidelines they're saying.
Yeah.
The thing is, these vaccines are microparticulate. These are different physical vaccines to the ones we've been using before. And
if you make it, go on.
We've looked at good scientific evidence that these microparticulates can cause inflammatory reactions in the body.
Yes. And if you make it, if you deliver it intravenously, you're sending it to locations it's not supposed to go to necessarily.
Absolutely. So it's supposed
and there's
to go
no data on that, is there?
No, well, only in animals. It's never been done in humans because, of course, it would be
the mice.
Yeah, but in mice they get pericarditis and myocarditis.
Yes.
No, it's supposed to stay in your. Of course, it's supposed to stay in your deltoid muscle, and it's the cells in the deltoid muscle and the cells in the lymph nodes that are supposed to make the antigen.
Yes.
The spike protein analog, which the immune system recognizes as being foreign. It's not supposed to make it in your heart or in your liver or in your kidneys or where else.
No.
And I think that's a big part of this problem. But as I say, I'm more than happy to be wrong, but it's just a variable we need to get rid of.
Yes. Well.
Anyway, thank you. I've kept you talking for far too long. I know you get tired. No, not at all. It's been a very complicated.
It is 10 months.
It is, and you really can't rush. We've managed to condense it down into an hour and 12 minutes, which is.
Sorry.
No, it's brilliant. It's brilliant, Nick. Thank you. And basically, I'm just hoping people relate to what we're saying.
I hope so. And if anyone stays to the end, they can hear about the Viennese brothel.
Indeed, yeah. We'll put that on as a teaser or something in the comments.
Yeah. Thank you very much, John.
Whenever you want to come back and talk again, you are more than welcome.
Thank you. I hope I'll come back with some news and
so do I.
Good news.
I hope we'll meet you with a GoPro on a jog.
Yes, and please, please carry on with what you're doing. Thank you so much for everything you do.
I really appreciate that. Thank you.
Bye bye.
Bye, Nick.